So during infancy, childhood, and adolescence, that's when you have the most growth, and it is gigantic. I mean, just a tremendous amount of cell division. So nutrition is important in supporting that growth. And this thing changes constantly. So as kids begin to self-develop and learn how to self-feed, then they start doing a lot of different things. My granddaughter, I just had to let you see that. So the most appropriate kind of foods for them to have during this point in time is things that are soft, like soft fruit, peaches, bananas, some things like that. Tender vegetable, cooked pieces of vegetable. Peas are okay, kind of French style green beans, that kind of thing. Cubes, slices of cheese, cottage cheese, kids usually like that. They're not so great with meat. Ground meats are usually better as far as that goes, but you see sometimes that doesn't work out so well. Pastas, macaronis, that type of thing, they usually love that. And then you see, I think she's even got some fruit on her tray. But the thing to remember is that milk still remains a main source of their calcium and their protein and their other nutrients as well. So when you're feeding a healthy kid from 12 to 24 months, their diet has to shift from infant foods and mostly formula and breast milk to mostly adult foods. And it's important to remember that their appetite decreases markedly near their first birthday, and it's just going to fluctuate a lot up until really 4 or 5 years of age. So they have to be given a good selection of food at regular intervals, and be sure that you offer things to them. Their intakes remain pretty constant, and they'll be right for each stage of growth, but you do have to have patience as a parent because it seems like they're not eating enough. On average, though, a 1-year-old kid needs about 800 calories a day, and then at age 6, the child need doubles to about 1,600 calories a day, and that's when it's harder to get in them. By age 10, 1,800 calories a day will support growth without causing any excess storage of body fat, and usually that's not when it's a problem getting in. It's when they're more toddlers, age 6, age 7, up to that point. If kids are fed vegan diets, it's really difficult to meet their energy requirements, and you have to be very creative in order to do that. As far as protein goes, the amount of protein needed increases as the child gets a little bit larger. So if you're talking about a pound-to-pound basis, an older child's need for protein decreases slightly relative to that younger child's need. So as they get older, that need decreases somewhat. As far as carbohydrate and fiber, a 1-year-old brain is relative to the size of the body, and the brain, remember, is what requires glucose or carbohydrate in order to function. So actually the glucose needs of a 1-year-old are going to fall about in the same range as an adult. Kids' fiber intake usually has to be adjusted downward. They don't need the same amount the adult has. As far as fat goes, kids' little stomachs they're small, so they can only hold so much food, and fat gives them a really concentrated source of food energy. Remember, fat has got 9 calories per gram, whereas carbohydrate and protein only have 4. So that is what they need a little bit more of, but you do need to make sure that you control the saturated and trans fats. Vitamins like fluoride, vitamin D, and iron supplements, because of their requirements, they sometimes need those supplementations in order to grow properly and get what they need. As far as minerals go, iron deficiency in kids is a major problem worldwide, and it remains one of the primary nutrient concerns for U.S. children as well, above the age of 1. So it's difficult and worrisome sometimes to try to get the amount of food in them that they need, just because their appetites vary so much as a toddler. The body shape of a 1-year-old, which is on the left, changes dramatically by age 2, and that's primarily due to the fact that they lose a lot of that baby fat as they begin to walk. So just like that 2-year-old has lost a lot of his baby fat, he especially has gotten some more muscles in his back and legs and buttocks, and then his leg bones, you can see how much they've lengthened. Early childhood years present a really big challenge to parents, because you have to influence their food choices, and that will influence their health today and maybe even potentially reduce their chronic disease risk later on. But it is a difficult thing to deal with their preferences, because they do change so often. Many parents kind of overlook the fact that perhaps the single most important influence on their kids' food habits is their own. So if you're not a vegetable eater, your kid's not going to be. They need to see you eating. One of the recommendations nowadays to get kids to eating better is for the parents to put the food in their plate first and then give a portion to the child, because they see that mom and dad are eating those same foods, and that way they're a little bit more willing to try things. Most children, as some adults, eat way too many fruits and vegetables, so on average they don't even obtain half of the needed amounts of those total vegetables that they require. By age 15 months, you see them start picking up on some things, but the primary vegetables and fruits they pick up on is French fries and bananas, and neither one of those are a really good source of the nutrients they need, so they need to have a little bit more variety offered to them. And you have to remember too that a kid has better taste buds than adults. They have a lot more taste buds, so the flavors should be mild. You can't give them really spicy things or very hot things, because they are a lot more sensitive to that than adults are. And you keep in mind too that kids go on food jags. They may have consecutive days of eating only 1 or 2 foods, and then next week they may tell you they hate those. So you just have to have patience. I can't stress enough the importance of making sure that you offer them foods that aren't choking hazards. So things like grapes need to be cut, nuts are a really bad choking hazard, pieces of hard candy, and large pieces of hot dog. Hot dogs need to be cut in like a circle and then probably halved or quartered in order to prevent them from getting stuck in their esophagus or causing choking. And a kid who's choking may not make a sound, so an adult has to be present while they're eating and keep an eye on them at all times. And they love to be included in food prep. And in fact, if you allow them to do some things like help wash off green beans or something like that, they actually do eat those better, because they help prepare them, and then you can praise them afterwards, even if they only take a few bites. So let's look just real briefly, I'm not going to go through all these, about some of the developmental milestones of preschool kids. Usually when they start 1 to 2 years, they start using a spoon. They're able to lift and drink from a cup. They can be messy. They can be easily distracted, but they begin to accept foods and refuse foods. And for serving sizes for a 1 to 2-year-old, about a tablespoon per year. So if they're a 1-year-old, they get 1 tablespoon for every food served. If they're 2, they get 2 tablespoons for every food served. This is my grandson, and you can see he's eating ice cream. So he feeds himself independently. He's age 3 at this point. He follows simple directions, although not consistently. Really has good developmental use of his hands, and certainly does request favorite foods. At the age of 3 years, about 2/3 the adult size serving is appropriate for a kid who's this age. When you get to 4 to 6 years, the serving should be about equivalent for an adult. And you see they're able to use utensils, a napkin. They can actually help in the kitchen as well. And then your 5-year-old can really be a big help in the kitchen. So if you've got the patience for it, then you should certainly introduce them to the kitchen and cooking. So nutrient deficiencies do affect a child's brain significantly. They do exhibit physical and behavioral symptoms. Something like an iron deficiency not only causes an energy crisis for kids, but it also weakens their motivation to really try different intellectual tasks, or it really is going to impair their attention span, and then as a result they're just not able to learn. And like it says, iron deficiency is the key problem among U.S. children today. And you can't supplement them because those supplements can be dangerous as well. Too much iron is just as bad. Lead is another thing, although it is getting better in the United States. More than 500,000 kids in the U.S., mostly under the age of 6, have a blood lead concentration high enough to cause problems. And those problems include things like mental, behavior, and physical health problems. In fact, it can get so bad as the lead toxicity grows or is consistent. It injures the kidneys and the nerves and the brain and the bone marrow, and a kid can even slip into a coma and can have convulsions and die if a diagnosis is not made in time. So it's important to have your water tested, because lead can leach into drinking water at a home from old lead pipes and end up in a baby's formula if they're taking formula, and it can even end up in your beverages like your tea that you would make. So children absorb more lead than adults because they can always lack the minerals iron and calcium and zinc, and those are kind of protective because they compete with lead for absorption. So they're at a higher risk than most adults. It is declining in the U.S., but it still is a problem, particularly if you live in an older home. All right, so today up to 8% of kids in the U.S. have food allergies, and it is something that parents worry about, particularly if that's something that kind of runs in their family. So it's important to distinguish between a food allergy, a food intolerance, and a food aversion. A food allergy occurs when a protein enters the body tissues and triggers an immune response. And that immune response that we are used to, it's when your body reacts to the foreign molecules as it does to any other antigen, and it starts releasing antibodies and histamine to attack those invaders. For some people, a food allergy can cause a life-threatening reaction, and we call that anaphylactic shock. And that can present symptoms like tingling of the tongue, throat, or skin, and then go on to more severe symptoms like difficulty breathing. And that has to be addressed immediately. A food intolerance is just an unpleasant symptom that occurs consistently after you consume certain foods, and it does not involve the immune response. So a food intolerance could be like a lactose intolerance. Maybe you get a lot of indigestion and diarrhea after you have milk if you have a lactose intolerance, but that is not an allergy. And then you have a food aversion, and that is where someone has an intense dislike of a food. And that is something that could have been triggered by an event that happened in the past. Maybe a food made them ill, and they just don't want to have that again. But that's considered a food aversion. It's not nearly as dangerous. So then let's look at dental caries. This is a really big public health problems, and it affects a lot of kids, up to about 42% of those between the age of 2 to 11 years old. And there's a lot of issues. We've fluoridated our water in an effort to fend off that dental decay, but what happens really is caries develop because of the acids that are produced by bacterial growth in the mouth. And if teeth are not taken care of, then bacteria tend to eat into that tooth enamel. When they do that, they form colonies and that happens in the plaque, and that sticks more and more firmly to the tooth surfaces unless they're brushed or flossed or scraped away like you would do at a physician's or a dentist's office. But eventually the acid of that plaque creates pits, and those deepen into cavities. And that can affect your gums as well. And you can see with this picture that bacteria that comes from those inflamed, those bacteria that cause that inflammation can really deteriorate the gums and cause problems later on. So it's really based on the length of time the teeth are exposed to carbohydrate in particular. So bacteria thrive on carbohydrate, and they can produce acid for 20 to 30 minutes after they've been exposed to carbohydrate in the diet. So the most important thing to try to minimize dental caries is to limit their sugar intake for kids. And the other thing is to limit the length of time that they're exposed to that carbohydrate. And that depends on how soon they brush their teeth after they eat, as well as the food's composition and how sticky it is, how long they have to have it or leave it in their mouth, and how often they eat it. So things like the food's composition, how sticky it is, how long it stays in their mouth, and how often they eat it will make a big impact on dental carie production, dental carie formation. So some of you ask about on your cards at the first of the semester, is breakfast really the most important meal of the day? And we do know that for sure it is for kids, and probably it's okay to say that yes, it is for adults as well. We know that kids who regularly skip breakfast are more likely to be overweight, and they also may have difficulty paying attention in the classroom. The nutrient losses that they lose if they don't eat breakfast, as well as adults too, are rarely made up in the other meals. So it's important to try to eat a little something for breakfast in the morning. We know kids perform poorly on tasks that relate to concentration, just like if you don't eat breakfast and you have an exam, you're not going to do as well. And then they also achieve lower test scores. And that's one of the reasons that the U.S. government has set up this unbelievable breakfast program for low-income students. And a lot of students take advantage of that, which is a good thing. So speaking of the school lunches, I know we all have probably some bad memories of school lunches, but it's important to realize that more than 30 million kids get their lunch through that National School Lunch Program, and more than half of them are free or reduced price. And many kids, that is the only full meal they get in a day. 10 million kids eat breakfast at school, during school time. And even during this COVID-19 problem with it not being, no kids not being in schools, schools are still serving breakfast and lunch at many schools, particularly if it is a school with a high percentage of low-income kids that are there. Some of the guidelines that you have to remember, and maybe why some of those meals didn't appeal to us that much as kids, was that those guidelines the government puts forth specifies that there's certain nutritional needs that have to be met within a specific calorie range, and it is based on the age and the grades for those kids. So as we move into adolescence, we need to notice that teenagers are not fed. They eat. So you have much less control over influencing what they do eat and how balanced their diet is. And again, parents can still play a big role by example. Growth spurts during adolescence really drive the amount of nutrition that kids, adolescents, and teens need. They're so connected with hormonal changes during this point in time, and those changes affect every organ in the body, including the brain. And there's a big difference between girls and boys. For example, weight gain in guys is more likely to be lean body mass and bone, and they gain more height, and they gain approximately 45 pounds during adolescence. But in girls, more of that weight gain is as fat, and that average weight gain for girls is around 35 pounds during adolescence. And hormones direct all that, so it's not something that is easily controlled. So they direct the intensity, let's say, of that growth spurt. Girls start first with their growth spurt, and it starts about 10 or 11 years old, and it peaks at the age of 12. But guys start at age 12 and 13. It usually peaks at 14, but their growth spurt continues much longer up to the age of 19. So guys will start later, but their growth spurt is significantly longer than girls. Boys' needs may be especially high. Girls' needs are usually less as far as calories go, but they peak sooner and decline much faster than boys' requirements do. And that depends on a lot of different things. Some of those factors that influence energy requirements are their proportion of lean body mass. And if you'll remember, guys have a much higher proportion of lean body mass than girls. Boys grow faster than girls. And then just in general, girls usually are shorter than guys, not always, but that's genetics. And then they are going to attain lower weights than boys. We'll talk a little bit about obesity in a minute, but just keep in mind that it plays a huge psychological role, particularly during adolescence. We'll look at some vitamins, but calcium is probably one of the more important ones. And this is when calcium intakes begin to drop because milk intake decreases. And then just having decreased activity also contributes to weaker bones, and that happens more often in girls than boys. So iron needs increase. Females, and they're at the age girls are when their menstruation starts, so they have a higher requirement for iron. Guys' requirements for iron are just based on their higher levels of lean body mass. Calcium intakes are lower in this particular age range, and it does contribute to weaker bones in girls just because of decreased activity. And then vitamin D is needed just as much as calcium is for bone growth, and that's why it's important to encourage them at this age to continue to take that fortified milk. So childhood obesity. is becoming a bigger and bigger problem. And with it, there's a lot of problems associated with chronic disease, like diabetes. Type 2 diabetes is really increasing in adolescent girls and boys. So prevention before adolescence is the key, and make sure to determine some of the problems associated with this group and some of the issues that kids that are obese have. So the main goal is to try to just reduce their BMI and keep their weight at the same, particularly boys, keep their weight stable, and they will grow into it. And then you focus on physical activity. So you don't focus so much on restricting their diet or their calories, but you do focus on trying to help them maintain their weight. Ideally, adults are gatekeepers. They control the type and availability of food in that teenager's environment. And so they can really help teenagers choose wisely by giving them teachable moments. Unfortunately, in reality, in many households today, the adults all work outside the home, and they may not even be there when kids get home from school. And so teens will shop for their families sometimes and even prepare meals for their families. So those gatekeepers are gone, and they don't have the same impact on the family's eating habits as they used to. So as we get older, how you live and think at age 20 affects the quality of your life at 60 or 80. So keep that in mind, because you are right there. So hopefully you have learned something from this course that you can carry out through the rest of your life, and you can do things to reach old age in good physical and mental condition. So people who do reach old age in a good physical and mental condition, you can see these are some of the characteristics that they have. They are non-smokers. They stay away from alcohol, or they drink only moderately. And if you remember, moderately for women is 1 drink a day, and moderately for guys is no more than 2. They're physically active. They are well nourished, and yes, they do consume fruits and vegetables. And then they maintain healthy body weights throughout their adult life. So these are just some nutrition-related problems of aging, and the number of people that report a disability increasing with age and is increasing. So women have a higher prevalence of disability than men at all ages. And the prevalence of disability seems to double in different age groups. So 18 to 44, disability is about 11%. When you get to 45 to 64, it's almost 24%. And then 65 years plus, it's 52%. So it does double significantly. And given the size of the baby boomer generation that's getting into their 60s these days, the number of adults with a disability is likely to increase significantly. And so that's going to require more appropriate medical and public health services for the next few years. But if we can just encourage people to increase their physical activity and reduce their weight if they're obese, stay away from tobacco and alcohol as much as possible, then that can really impact these typical numbers that you see on the screen. An estimated 70 to 80% of the average person's life expectancy depends on their health-related behaviors. Genes, your genetic profiles, determine the remaining 20 to 30%. In the U.S. today, an average person can expect to live 79 years. Now that's different. That's just an average. So that is different for women. They usually have a life expectancy of 4 to 5 years longer than men. And then ethnic groups are different than Caucasians. After about the age of 50, the intake recommendation for energy assumes about a 5% reduction in energy output per decade. So as far as energy goes, it does decrease our requirements decrease after the age of 50. And there are certain conditions that are associated in adults with what we call failure to thrive. And that's the adults that have a lot less physical ability to function. They are unable, because of disabilities, to maybe shop for food or even cook and prepare their food. They may be suffering from depression or anxiety. A lot of adults are also suffering from malnutrition, and that could be a problem with their immunity that's not what it used to be just because of age-related changes. They could be having problems with wound healing. Maybe they're a type 2 diabetic and they have ulcers on their feet, then that's going to be a problem with wound healing. They may have to have surgery, and then as a result of that, have a really slow recovery from that surgery. And then hospitalizations are not uncommon periodically as people age. So one thing that we're going to look at in just a minute, I think, is sarcopenia. So that is just an age-related loss of muscle tissue, and that does have some serious health implications as well. And we'll look a little bit more in physical activity. Protein requirements, there's been some research, and older people may even be able to better attain their muscle mass and function if they have a little increase in the protein in their diet. Now, I don't have a specific number, but let's say that you and I require about 0.8 grams of protein per kilo. As people age, they may go up to as much as 1 gram of protein per kilo in order to maintain their muscle mass better. Because that at that point it begins to stimulate their muscle synthesis. Carbohydrate and fiber, probably everybody's got to have adequate amounts of carbohydrate to spare their muscle and spare the protein to build muscle. As far as fiber goes, with this age group, a low fiber intake and inadequate amounts of fluid and that low physical activity, all that leads to constipation, and that leads to discomfort and problems later on. So this is a picture of sarcopenia, and that top picture is like a 20-year-old woman's thigh. It's a cross-section that's been done with like a CT scan, for example. The bottom one is a 64-year-old woman's thigh, and you can see the dark part is the muscle. And even though these thighs are about the same size, the older woman's muscle has deteriorated significantly. So from the outside, they look the same, but when you cross-section them, it's significantly different. So such a big weight or muscle loss is going to be prevalent in aging, but not inevitable if we continue to give them adequate nutrition and protein and encourage physical activity. So fats do play a role as well as protein, and fats in arthritis seem to be linked to some degree. Some types of fats can actually benefit or help in the problems associated with these different types of arthritis. So the first one's osteoarthritis, and that's the most common kind of arthritis, and that just results in joint pain and pain on movement as a result of the deterioration of the cushioning around the joints. But they've noticed that just moderate physical activity can really reduce that pain and improve the quality of life. Now the picture depicts rheumatoid arthritis, or RA, and this is really significantly different from osteoarthritis because RA is an immune system issue where your immune system attacks the bone coverings and it treats them like a foreign tissue, and then it begins to go, the immune factors in your blood begin to go to those bone coverings and those areas around the joints, and they become swollen in the joints and really inflamed, and it causes a tremendous amount of pain. They have found that omega-3 fatty acids may have a role in the treatment of that type of osteo or that type of arthritis. And then gout is an inflammatory arthritis. It increases, the prevalence of it increases with age. And they are finding that the DASH diet, the diet to decrease your sodium intake and hypertension, may actually decrease inflammation if it's followed. So as people age, there are certain vitamins that need to be concentrated on. We know that vitamin A absorption increases with aging, so eating a lot of vitamin A sources could potentially result in a toxicity. It's this age group, if you'll remember, we saw pictures of people that had vitamin A from beta-carotene. They ate too many carrots or foods that were high in vitamin A, and they got the yellow tinge to their skin. This is much more common in an older age group than younger folks. Vitamin D, we're not able to synthesize it with sunlight. As we get older, their ability of the skin to do that decreases significantly. Plus, our kidneys don't work as well, so we can't activate the vitamin D the way that you have to do in order to make it something that your body can use. Supplements are often recommended for the elderly or the aging adults just because of all these facts. And then vitamin B12, if you'll remember, that is one that you have to have intrinsic factor, which is produced by your stomach in the acid part of your stomach. And the reduced stomach acid can lead to poor absorption because that intrinsic factor that's required for vitamin B12 absorption is no longer produced adequately. And so older folks are not able to absorb it. Plus, they may have a decreased intake of animal products. And if you'll remember that vitamin B12 is one of those vitamins that you must have animal products in order to get adequate amounts. By age 75, about 1/2 of all Americans have developed a cataract. And this is where a reaction kind of clouds the lens, and eventually, if it's not treated, then it can lead to blindness. So high intakes of foods with antioxidants seem to reduce that risk. Particularly, it reduces the risk of that occurring much earlier. So that's things like beta-carotene, vitamin C, and vitamin E. Remember, those are your main antioxidants in your diet. Probably one of the big risk factors for older adults is dehydration. And that is primarily because older adults do not get that trigger of thirst like younger folks do when they are getting slightly dehydrated. That is a trigger that they miss. So then dehydration leads to problems like constipation, bladder problems, kidney problems. It can even lead to mental confusion, and that can be kind of mistaken for senile dementia, which that can lead to a whole other problem. If somebody is bedridden or if they are disabled, then that dehydration can also lead to what we call pressure ulcers, which is breakdown of the skin, particularly in the back and the buttocks, and like on the elbows, that type of thing. Iron status generally improves in later life, particularly for women, but if they do have poor iron levels, that deficiency can significantly affect their appetite, which just makes it a continuous circle of deficiency. Zinc deficiency can impair immune function. We know that it can depress the appetite, and that just is because a zinc deficiency does have an effect to blunt the sense of taste. And zinc deficiency could increase your likelihood of infectious diseases like pneumonia. This is another one of those vitamins that's been taken in megadoses these days. And there's physical changes to aging that's going to affect nutrition. And one of those is in the GI tract. And you can see all the things that can happen here. The intestines can decrease their motility, and that leads to constipation. They can have aging adults can have stomach inflammation, and they can have reduced acid output, which impairs their ability to digest and absorb certain foods. And then they may be scared of choking too, so they can reduce their intake as a result of that. And then you do have a lot of hormonal changes, particularly in the pancreas, because it secretes less insulin as people age, and they can get what we call glucose intolerance, just an abnormal glucose metabolism that will increase their blood glucose levels slightly. Aging adults can lose their teeth, they can get gum disease, they can have a chronic reduction in their saliva, and that is like a dry mouth syndrome, which is something that can really cause problems with chewing and swallowing. So choking is more likely as people age as a result. And then they have less ability to see. They may have cataracts like we've talked about, and then they got diminished senses of smell and taste, and that also can affect their appetite significantly. Finally, physical changes that affect nutrition is just body composition itself. They have weight loss and decline in lean body mass, so that's sarcopenia, where they do have decreased muscle mass, and that causes problems with their movement, and even though physical activity can help, some will not be able to have the type of physical activity that as young people you think is just typically normal for you. So all of these things are important as far as adults go, is to make sure that we encourage them to do all these things. Physical activity guidelines for Americans recommend that older adults try to have about 150 minutes of physical activity a week, or whatever amount they can safely perform, but they should strive for that. As far as lean body mass goes, we know that older adults who have more lean body mass have better balance, better immune systems, they sleep better, they're able to prevent falls because they're stronger, and when they do fall, they have fewer injuries as a result. They experience fewer symptoms of arthritis, and in general, they're just happier, live longer than their less fit peers. So, simply put, active older people look more like younger people physiologically. Muscle loss does occur. We've kind of talked about that. Perhaps as early as 60 or 70, the muscles start to lose their efficiency in adding new muscle tissue, even if somebody is doing resistance training like you see here. So some extra protein at every meal might help to do that, because older muscles require a little bit more protein to speed up that protein synthesis after exercise. Speaking of exercise, every elderly person is going to face different degrees and types of physical limitations. So each one should exercise in their own way, but they should maybe seek help in devising a sensible exercise plan. So some of you that are in exercise science, I would encourage you to think about working with older people. We're not that bad. And I'm telling you that that is a group that, while you all are going to be working at your life's work, that is a group that you are going to see more and more and more of. And your expertise is going to be required for these boomers. So most chronic diseases do involve some type of inflammation. And the longest lived people, and they're in different parts of the world. Okinawa is one that has a really long. Loma Linda, California, people have a longer lifespan. Costa Rica, people have a longer lifespan. So those longest lived people, the theory states, they have an optimal balance between inflammatory and anti-inflammatory influences. So they have inflammation, but they also have a well-balanced diet that impacts those anti-inflammatory influence, those free radicals that are there. So those antioxidants that you get from fruits and vegetables are even more important as you age. Foods or supplements, can they affect the course of Alzheimer's? We do think that there are some things that can, like healthy eating patterns, like the Mediterranean diet, like I told you about, have been associated with slower mental declines in aging. So we think that there is a connection between the part of the brain that coordinates memory and cognition and how it can get cluttered with abnormal protein fragments and tangles of nerve tissue that can damage or kill brain cells. And then we do know that those that have a higher level of blood omega-3 fatty acids can combat that to some degree. So older folks that eat a larger variety of foods are better nourished and they enjoy a better quality of life. And there are many programs that are given through the federal government that can really provide help for those people. The first one's Social Security, and it gives income to retired people older than 62 who paid into the system while they were working. The Supplemental Nutrition Assistance Program, or SNAP, and that was formerly what you would call the food stamp program, and that assists the very poor by helping to supplement their monthly food budgets. And then the Administration on Aging has several services that they coordinate with the Older Americans Act, and that provides meals, nutritious meals in either a social setting where they can congregate with each other or in their homes, so home-delivered meals. And then it also supplies shopping help and counseling and other services. Even transportation is provided through the Administration on Aging. And then the Meals on Wheels is typically provided through volunteers and through private funding. And that is something where nutritious meals are delivered to the home 5 days out of 7 of a week. So malnutrition is a problem, particularly with this population. Up to about 1/4 or 25% of adults and a half of hospitalized older adults can have malnutrition. And we think it's due to things like their socioeconomic status and the fact that they're living at home, so depression's going to play a role in that, and then even their medications that they're prescribed, whether they're just have a polypharmacy, they have a lot of meds that they're supposed to take and they can't afford good nutritious food, or they are on medications that interfere with the absorption of certain nutrients. So we know that a lot of elderly have about a significant problem performing what we call ADLs, or activities of daily living. And if you ever work with adults later or older adults, you will have to evaluate how many activities of daily living they're able to perform. So that is a measure that we use in the medical community in order to ascertain the quality of life of an elderly person and how we can impact that by improving it. So these are risk factors of poor nutrition status in older adults. So just so you know, inappropriate food intake and poverty and isolation, a disability, chronic diseases that they have, their medication use, and then if they're over the age of 80. Those are the major risk factors that can truly impact nutritional status. And it just kind of gives you some indicators of what you would look at to decide what kind of disorders or problems that they have and how those things can be addressed. This is a quick and easy to remember list of factors that decrease the likelihood of malnutrition in the elderly, and in fact, they were used in a questionnaire that is sometimes given in physician offices in order to identify those that are at greatest risk of malnutrition. And you see, if you look down, to determine on that left-hand column, determine is spelled out as an acronym to help people remember. But this is a questionnaire that is given sometimes in physician offices to identify adults who are at risk of malnutrition. And I put this on there just because I just thought it might be a good idea of something that you might want to hang on to, because if you do, if you are so inclined to work with the elderly in your job, whatever that turns out to be, then these are just some goals that you might want to make sure that you encourage them to practice. So you practice the items at the base of the pyramid most often for successful aging, and then use the inner compartments to create a balance, whether that be nutrition, health, physical activity, social health, and emotional well-being as well. And then use the tip of that pyramid to manage those everyday stresses. So like traffic and exams and work deadlines and all that type of thing. So this is something maybe you can hang on to, and I hope that you reach the ripe old age of 127 or whatever it is that we can potentially